lot of people hear the words hip arthritis and think that their body is falling apart or that surgery is around the corner. That's not the reality. Hip arthritis is common, but it's also manageable when you understand what's driving it and you train in a way that optimizes the function of the hip. Today, I want to break down what hip arthritis actually is, some of the contributing factors, the symptoms you should pay attention to, and some exercises that make the biggest difference. Think of this as the roadmap that helps you take control of instead of feeling controlled by your hip. Hip arthritis usually refers to osteoarthritis of the hip. That's the gradual thinning of cartilage inside the joint, along with changes in how the surrounding tissues function. Although there are other forms of arthritis, this is what people are most commonly referring to when they say arthritis of the hip. Cartilage doesn't have nerves, so the associated pain people feel is usually coming from the structures around the joint, including the joint capsule, the muscles, the tendons, or the inflammation around the involved area. Arthritis doesn't mean that the joint is crumbling. It means that the joint surface and the environment around the joint are in need of an upgrade. The hip is designed to allow movement in multiple planes and to transfer force between your spine and your legs. When the biomechanics of your hips are restricted or imbalanced, the stress on the hip increases. Over time, the irritation and the joint dysfunction are what people refer to as arthritis. There are a number of different factors that contribute to hip arthritis. Number one, loss of hip mobility. When you lose internal rotation or hip flexion, the joint cannot distribute pressure evenly. You end up overusing one part of the joint and underusing others, which accelerates irritation and localized pressure at one spot. Cause number two, weakness in supporting muscles. Weak glutes, weak deep hip stabilizers, and even weak core muscles force the hip to take a load that it shouldn't. Good strength allows the joint to function with less friction. Cause number three, poor movement patterns. If you walk with your toes pointed out, or your knees collapse inward, or you hinge through your back instead of your hips, you increase the mechanical stress on the joint. Cause number four, previous injuries. Old hip injuries, low back issues, ankle injuries, and knee injuries all change the way that you load your hip. The body compensates to avoid pain, but those compensations increase pressure in and around the joint. Cause number five, sedentary lifestyle. Yes, you did hear me correctly. Sitting for long periods weakens the hips and tightens the hip flexors. The joint then becomes stiff and inflamed because it isn't getting the nourishment that comes from movement. Cause number six, natural age-related changes. We all lose some cartilage thickness as we age. This can be tied to metabolic dysfunction and even to something as simple as level of hydration. The key difference is whether the surrounding muscles are strong and coordinated enough to support the joint as it slowly deteriorates. So what are the symptoms of hip arthritis? Number one, deep groin pain. Most hip arthritis pain is felt in the groin. That's because the hip joint sits deep inside the pelvis and refers pain outwards. Number two, stiffness when standing up. You may feel stuck or slow when you get up from a chair or out of your car. That startup stiffness is a classic sign. Number three, pain with rotation. Turning your leg inward or outward can bring on sharp or pinching pain. Symptom number four, trouble putting on socks or shoes. Loss of rotation makes simple tasks feel harder than they should. Symptom number five, clicking or catching. This is usually from tight tissues or imbalance tracking. It doesn't automatically mean something is torn. Symptom number six, pain after long walks or long periods on your feet. This is often a sign the supporting muscles aren't absorbing the load properly. And symptom number seven, pain at night when you're sleeping. Pain at rest is a common sign of osteoarthritic dysfunction. When might you need a hip replacement? Most people with hip arthritis don't actually need surgery, but you should consider a hip replacement when pain is constant, function is significantly limited, and when mobility and strength work no longer offer relief from your symptoms. When the joint is so irritated that walking, sleeping, and basic tasks are consistently hard despite solid rehab, and let me repeat that. When the joint is so irritated that walking, sleeping, and basic tasks are consistently hard despite appropriate rehab, that's when surgery becomes the right tool for the job. Before we jump into the exercises, here are the main ideas behind hip arthritis treatment. Principle number one, we want to improve mobility in safe directions. The hip needs rotation, flexion, extension, and abduction. When the hip joint moves better, pressure is distributed better, and this results in decreased symptoms. Principle number 2, strengthen the muscles that stabilize the hip. Better strength means less irritation and less pain for you. Principle number 3, address the whole chain. Your hip doesn't work alone. Your core, glutes, quads, hamstrings, and ankle mobility all influence your hip. Principle number 4, use movement as medicine. Arthritis often feels worse when you avoid movement. Controlled movement is what helps the joint calm down and remain lubricated. So what are the exercises that can help hip arthritis? Well, here are some exercises that you can start today. I'll explain what each one does and how to perform it safely. Exercise number 1, hip flexor release on a chair. What it does, it reduces tension in the front of the hip so the joint can extend more freely. Sit at the edge of a chair. Slide one leg back behind you so that the hip stretches gently. Keep your chest up tall. Hold for 20 to 30 seconds. Repeat 3 times per side. Tight hip flexors pull the joint forward and increase pressure inside the hip. Exercise number 2, seated hip internal rotation stretch. This restores rotation, which is one of the first motions to disappear with arthritis. Sit tall with both feet flat. Let one knee fall inward. Repeat 10 times per side. Better rotation spreads load evenly throughout the hip. Exercise number 3, the glute bridge. This strengthens the glutes, which unloads the hip joint. Lie on your back with your knees bent. Press through your heels and lift your hips until your body forms a straight line. Lower back slowly. Do 3 sets of 12 reps. Strong glutes reduce shear forces inside the hip. Exercise number 4, standing hip abduction. This activates the side of the hip to improve stability. Stand tall and lift one leg out to the side without leaning. Slow and controlled, 3 sets of 10 to 12 reps per side. Better lateral strength helps with walking, stairs, and stability when on a single leg. Exercise number 5, a supported squat or sit to stand. This builds strength through a functional range without aggravating the joint. Sit on a chair, stand up using a slow, controlled motion. Lower back down gently to the seat. Do 3 sets of 10 reps. This improves quad and glute strength, both of which are essential for hip health. Exercise number 6, step back lunge or a mini step back. This strengthens the hip through extension and improves control. Hold a countertop or a chair for support. Step 1 foot back and lower slightly, keeping the front knee centered. Perform 3 sets of 8 reps per side. This trains the muscles that stabilize the hip during walking. Hip arthritis doesn't mean you're fragile and dysfunctional. It means the joint is in need of an environmental upgrade. When you restore mobility, strengthen the right muscles, and move with intention, the hip becomes more resilient and less irritated. You'll walk easier, stand up smoother, and feel more confident in your daily movements. Stick with these strategies and exercises consistently, and you'll start to notice real change in how your hip feels and functions. More importantly, you will delay the time at which you need to come see someone like me for surgical treatment.